If you've been told that your pelvis issues are nerve related, but you don't know which nerve it is, you're not alone. There are two nerves today that I want to discuss. One is splanchnic nerve, the other one is pudendal nerve. So we're going to see what the difference between the two are and why they get confused, or they look at one and not the other and beyond, and what to do about it. So both of these nerves come from your sacrum. So they have sacral nerve second to fourth that are involved. That's this portion, the back portion. Like in me, it would be, this is my sacrum. So they exit through here. Now, splanchnic nerve is in charge of the parasympathetic function. So let me explore here a little bit of anatomy here. You have nerves that are in charge of sensation. There are nerves that are in charge of motor function, movement function. Some nerves have both of those. And then you have nerves that stem from your autonomic nervous system. So they're not your central nervous system, they're your autonomic nervous system, which reside in this situation in the sacral area. So the sympathetic function of splanchnic nerve are those functions of your bladder, your bowel, and your viscera that you don't have a control over. So your bladder is kind of interesting because your bladder is part autonomic nervous system and part central nervous system that involves it. But I don't want to digress about that, but I just wanted to throw that in. So when you go in with issues, pelvic related issues, I look at, obviously, your history is so important. I look at your history to kind of see what is going on symptomatically and what is going on with the specifics of what's inside this pelvis. So let me explain. The inside of your pelvis works with the outside to stabilize the pelvis. When the stability from outside is not happening, the muscles on the inside have to make up for it. When they make up for it, they get inflamed, they get tight, and whatever resides on the inside is going to be impacted. So if it's a nerve, you're going to have nerve issues. If it's a bladder that's being squished and being irritated, you'll have bladder issues. You can have intestinal issues, constipation. You can have prostate issues. You can have ovaries and uterus issues. You can have blood vessel issues. Anything that resides here becomes a resident of this household. And when the household gets smaller, those residents speak up. So you have more than one nerve that goes there. In fact, I've done videos on all of this before. If you have not subscribed to the channel, make sure you do, because I do these videos regularly. And make sure you turn that notification bell on so you get notified when I post these things. But back talking about these things, what splanchnic nerve, pudendal nerve, sciatic nerve, whatever the issue nerve is, if it's constipation, if it is bladder dysfunction, if it's pelvic congestion, all of these are different manifestations of lack of environment that allows harmony in this area. So what's the fix? The fix is giving back the stability here. The fix is not an injection. The fix is not Botox. It is not nerve block. All of those are to bring your symptoms down. The fix is removing whatever led to the problem to begin with. So I'm not talking about the incident. I'm talking about what did that incident do to your body. So we're talking about pelvic stability, and to stabilize the pelvis, what do we do? In the world out there, majority will give you a workout, a handout of this exercise and that exercise. I'm against that also, because your issues are not in isolated parts, and your body parts don't function in isolation. I am a huge fan of developmental exercises. These are the exercises you and I and every walking human being on the planet Earth has done to go from a helpless infant stage to become a running toddler. No bands, no weights, no gyms, no guidance. So we use those same exercises. I use those same exercises to convey to my patients what principles of movement are and what to look for. Those principles are then applied across all activities. So your role is to be an apprentice learning how to be. It's a lot more on you, but once you learn that, you understand how to be for the rest of your life. If it materializes across all the world, these developmental exercises, to get you moving, it will do it again. And that's the point of this video, to share with you that there is more than pudendal nerve, to share with you that injection and Botox injection, cortisone injection, nerve blocks, these are all going to not still fix your problem. So pay attention, do your due diligence to understand what environment your body functions the best at. I know that requires more of you, but it always did. Always did. Thank you so much for watching. Make sure you use one of the contacts in my description box to contact me if you need help. And until next time, take care.